Before we get into today's topic, which is mood, let's talk about your background, your training. I guess you've written about 10 books, assistant clinical professor at UCLA. Tell me about that.
Well, I started off in psychiatry and discovered very soon that people's mental health is not just related to their brain and the neurotransmitters from the neck up. It really has to do with blood sugar, hormones, thyroid, adrenal. There's a whole lot going on. And I actually wrote the books out of self-defense because I found I was explaining the same information over and over again, and people didn't always get it in the first round. And I understand that. You come into a doctor's office, there's a lot to, you're nervous, and there's a lot to discover and a lot to say. So in writing the books, I've actually given people a chance to read it at their own pace and look up the things that are applicable to them. In fact, I have questionnaires. My two most recent books, 8 Weeks to Vibrant Health and Natural Highs, have questionnaires at the beginning. So people can actually look at them, score it themselves, and then go to the section of the book that applies to them. And then if they still have questions and still need professional help, then they can go to the right place, to me or to some other of my colleagues, because I also give resources both on my website and in the books.
Okay, let's begin with your approach and your philosophy with handling things like depression, anxiety, and mood disorders. And from my understanding, you don't have a traditional style, what somebody would think of a traditional psychiatrist. Is that correct?
I do not have a traditional psychiatric practice, that's for sure. Because most psychiatrists are basically dealing with, is it a Prozac deficiency or a Ritalin deficiency?
Okay.
I'm looking at the whole person. What's their lifestyle? What are they eating? Are they eating regularly? Do they have food allergies? Do they have a hormonal imbalance? I see many women coming into me to see me. Many women coming in to see me have, for example, PMS or menopausal symptoms, and they're put on drugs, on medications, on mood-altering medications, when what they really need are supplements that will help adjust their hormones.
But some of these drugs work for depression.
They may
anxiety.
work, but I got to tell you, they come in to see me with terrible side effects.
Okay.
Imagine having to have make the decision when you're taking an antidepressant. Well, my mood's not too bad, but I don't feel so sad all the time, but I also don't feel really happy when I should be happy. And I don't really cry when I ought to be crying when something sad happens. I also have no libido. How would you like that? I mean, I've had men and women come into me where their libido is shot because of as a side effect of the drug.
So are you able to take care of these things naturally? I mean, do you see it in your practice?
Yes. Yes.
Without meds, in many cases?
Well, in fact, I will use medication when necessary. I will use prescription thyroid medication. I will prescribe natural bioidentical hormones for men and women. So I'm not averse to medication. It's using the most natural form and in the least amount possible, and targeting it correctly, not just saying, well, oh, depression, you probably need this. But I actually do some testing, very specific testing, so that I'll know what medication is likeliest to work. But way before I do medication, I'm using natural means.
So what are you finding in your practice? Somebody comes in, they're in their 50s or late 40s. They don't feel the way they used to. They got depressed.
Oh, that's a common one, yes.
So what what are you finding?
I'm finding that their hormones are getting low. People are stressed, for one thing, and stress burns out the adrenals. The adrenals are these little glands, the fight or flight glands that sit on top of your kidneys, and they get really stressed by our lifestyle. And people, one of the telltale signs is feeling very tired around 3, 4 in the afternoon, or waking up at, say, 3 in the morning and not being able to fall back to sleep. Those are signs of adrenal problems. They're not addressed in regular medicine. Or depression that's really based on a thyroid deficiency. So how about let's treat the thyroid, and they don't need an SSRI or an antidepressant.
Is that right? I mean, you've seen that.
Oh, many times.
Somebody comes to you, they're depressed, and really they have a low thyroid.
Absolutely.
And that did it.
Yeah, even bipolar patients. I've had a lot of success with bipolars, and I never tell people that I'm going to take them off their medication. Sometimes that'll happen, but even if they're then on lower doses of medication, what I'm actually doing is helping address the root cause of their brain imbalance. It may be a neurotransmitter imbalance that I can correct with some, say, serotonin enhancer, some tryptophan or 5-HTP.
These are natural,
really
non-prescription?
Absolutely natural. And also, there's been very good research showing that essential fatty acids, the omega-3s, are very, very good at helping with bipolar illness. In fact, there was a research study showing that a group of bipolars who were not doing well on meds did very well on the omega-3 fatty acids on fish oil.
Dr. Cass, we're going to take a quick break. We come back. I want to know the specifics of what you're doing, what you're giving them, what you're suggesting for people that are depressed. You're watching The Wellness Hour, leader in medical news and information. We'll be right back.